About 13.5% occurs because of BRCA pathogenic variants. In women with normal BRCA pathogenic variants, they are about less than 2% risk to develop ovarian cancer. However, in BRCA carriers, the risk is up to 48% risk. So, as a risk management strategies, these women are usually recommended with risk-reducing salpingo-oophorectomy, which is removing of the unaffected ovaries. However, in terms of screening, they are not usually recommended with screening because many studies have proved that annual screening of ovaries is not helpful to find cancers at a curable stage. In terms of gaps, RSO is actually complex diseases because not BRCA pathogenic variant carriers develop cancers because their penetrance are varies, and also they face multiple diseases because they also need to manage the risk of they need also to manage the menopause risk and also the risk of breast cancer. And currently there is a limited understanding about the decisional needs in Malaysian and Asian settings, and there was a lack of intervention tool to support decision making in Malaysian BRCA pathogenic variant carriers. So the overall aims for this study is to explore the decision making experience and needs in Malaysian BRCA pathogenic variant carriers, and to develop a decision support, which decision aid as an intervention to support the decision-making process, this complex decision-making process. So the frameworks that guide the overall methodology is Ottawa Decision Support Framework and COPE in Deliberation Frameworks. Based on this framework, the study is divided into 3 phases. First is need assessment using exploratory study, which then inform the content of the PDA development, and then the PDA then field tested with the target users, which is BRCA pathogenic variant carriers and gynecology oncologists. So I will just highlight the main findings. For the decision-making experience, women seek balance in terms of reducing the risk and also the importance to maintain their womanhood as well as the commitment as a wife and mothers. But what's different from what has been found in a Western setting, many emphasize the important role of husband as well as to maintain the marriage harmony when they are making decision about whether or not to remove the ovaries. Next, about decision-making needs, apart from the need for adjustment periods, women highlighted that they also need support from religious bodies. For example, the fatwa to actually guide them whether or not it's okay to remove the unaffected ovaries. So based on the findings, it informed the content of the PDA. So the PDA is developed based on the 5 systematic approach of decision making. And then the PDA then review and revise based on comments from the expert patients. Healthcare providers will provide care for this patient as well as the expert in patient decision aids. So this is the overview of the PDA. And then the PDA then pilot tested with the BRCA pathogenic variant carriers who still haven't decided about their ovaries. And then also with gynecology oncology. So most of them found that the PDA is comprehensible in general, and the information, the content actually contain the balance and right amount of information, as well as they found the content actually helpful for them to make a decisions. In terms of the impact, we now understand the needs of this patient and uncover the socio-cultural needs of these carriers and inform the development of the PDA. And then the PDA is now available to support the decision-making process. And then next, it can be found, the Malay version and English version, in the UMCRI website. And as a supporting documents, for future land course that will be launched in March 2024 is mainstreaming genetic testing for cancer treatment. This is the implementation strategy for mainstreaming cancer genetics in currently for hospitals, which is it's one in JB, USM, Kota Kinabalu UMMC. I think that's all. Thank you. So I would like to acknowledge the expert who supervised the study, which is Prof. Aisha, Dr. Lee Yukong, and the grants, Terry Fox Cancer Research Malaysia grants, and University Malaya grants.